Hi, let me share with you what I have learned in LLM 104 professional practice. So, according to the Canadian Nursing History Collection, people in the early civilization knew that they need medical attention, and there was no specialized nursing role during those times. We began as a helping profession, and it was the nuns who are caring for the people. Our founder of modern nursing, Florence Nightingale, had proven people that our role is important in making changes in the healthcare delivery system, and nursing was a valuable profession. Florence Nightingale made an impact as she made a definition to nursing practice. We are still using her knowledge in infection control and prevention today, as well as her statistical knowledge in guiding us to use our collection of information more valuable in modern clinical practice. She also established formal education to nurses. We can practice our profession up to this day with the provision of College of Nurses of Ontario. This organization aims in promoting safe nursing practice that recognize the possible cause and prevention of potential hazard to the people. In addition, it also addresses the needs of the public, especially at these challenging times where we are battling with COVID-19 pandemic. Healthcare workers during this pandemic are innovating and developing together. Indeed, change is inevitable. Nursing is always changing. Over the years, our role as nurses in the contemporary practice have adapted to the evolution of nursing professionals. We are continuously learning during this catastrophe. Nurses are provided with guidelines in responding to the pandemic. We are now actively involved in improving our healthcare system in Canada to boost and strengthen nursing. Our profession requires us to maintain our competencies that demonstrate the standard nursing practice and guidelines. These guidelines provide ethical care and improves quality safe with evidence-based rationale to all of our decision makings. Furthermore, Canadian Nurses Association advocates health public policy that both science and art are concerned in enhancing the healthcare system. Moreover, it is significant to practice our nursing code of ethics and ethical standards in quandary. This will guide us mostly when we encounter ethical dilemmas throughout our practice. The Canadian Nurses Association has provided the aspirational and regulatory framework for Code of Ethics to provide safe and ethical care to all at-risk patients. We have a legal and ethical obligation in promoting safe, compassionate, competent, and ethical care. Our patients should also exercise their autonomy as we actively involve them throughout their care. We educate our patients with ethical implications and issues that concerns their health. We act as a nurse advocate regarding our patients' health, concerns, and issues. Advocating patient care is our key tenet of practicing our profession. The Canadian Nurses Association represents the nurses in Canada healthcare system. We are provided by clear and concise guidelines for nursing professionals. We need to build our theoretical, practical, and clinical knowledge as we identify the new trends that will improve the quality healthcare deliverance. It is necessary for us to develop our skills and competencies. As a student and an aspiring nurse, it is important that we understand our responsibilities and obligation as future nursing leaders. It was expected from us to know our roles, values, and responsibilities as we practice them at our workplace. Our critical thinking skills and abilities to solve problems using the nursing process will help us in avoiding errors. Nursing process guided us in formulating healthcare solutions because our patient safety always comes first in providing safe and quality care. As future nursing leaders, we are accountable in being actively engaged in advancing the quality care that we give to our patients. In the same way, we are also accountable in using the standard of practice and legislation, as well as knowing our scope of practice by having guided by the Code of Ethics. Understanding the organization and its guideline will provide us the strategies to become successful in our chosen profession. Indeed, nursing is embodied both art and science. Integrating our theoretical knowledge in the art of caring is indeed a work of art.